Okay, we going? Alright, so I've washed my hands to prevent spreading of germs. My name's Charlie Hogan. I'm going to be doing a head-to-toe assessment. Is that okay with you?
Yes.
Alright, at any point you have any questions, you can ask, okay? Alright, vital signs were 98.6 for temperature, 117/82 for blood pressure, 18 on his respirations, and 72 for heart rate. So first we're going to get started. What is your full name?
Michael Hogan.
Okay, where are we?
Oh.
Okay, and what are we doing today?
An assessment.
And what year is it?
2020.
His mood is good. He's alert oriented ×5. So then I'm going to assess his skin, and throughout the video I'll just assess the skin for each area that I'm assessing. But skin is fine. There's no lesions, no tattoos. His temperature is normal. And we feel that with the back of our palm. His fingernails cap refill is less than 3 seconds. Equal bilateral. There's no clubbing. They're trimmed pink. Okay, you can rest your hands. Then we're going to move on to the head. It's normal cephalic, it's symmetrical, there's no lesions, nothing like that. If there was, we would use the A, B, C, D, E, and the A is for asymmetry, B is for border, C is for color, we're looking for black and blue, D is for diameter greater than 6 millimeters, and E is for elevation, okay? And so then we're going to check carotid. So the way that we do that is we only do one at a time. First we'll feel and then we'll listen. I'll listen with the bell of my stethoscope. So, and they're equal on each side. And then when we're listening to make sure they're equal and there's no bruit. Alright, and then we're going to palpate the lymph nodes. So we have preauricular, postauricular, and then we're going to have occipital, and then lift your head up a little bit, tonsillar, here you can look down a little bit, submandibular, and submental, anterior cervical, posterior cervical, and then look to the side. We'll do the deep cervical. These are hard to feel. Look to the side. And then we have the supraclavicular. Okay, and those, when you're palpating, they should be non-tender, really tender. Okay, and they should be movable upon palpation. Okay, and then so we're going to look at the hair and scalp. His hair, he does have a slight receding hairline. The hair's brown. There's no lesions or on the scalp. And the skin is uniform on the scalp. And then we're going to move down. Eyes on the face are on the upper third. Nose is midline, and the mouth is on the bottom third, okay? All right, and then we're going to assess the eyes first. So what we're looking for in the eyes, the sclera should be white and the conjunctive pink, and that is, he's got that. And then we're going to check for PERLA. PERL stands for pupils equal, round, reactive to light. And I have a flashlight here. My pen light never works, and this flashlight barely works. But when I use the light, the pupils should constrict upon light, and when I move the light away, they should dilate. Okay, so I'm going to turn off this light and look. Okay, and then look at my finger, and then look at the wall behind me. Okay, so they are PERLA and they are accommodating. So then if I had ophthalmoscope, we would look at the optic disc, the optic nerve, and it would look at the veins in the eye. So then we're going to move on to the nose. We're going to check patency. So his septum is midline, and then if you'll take your finger and close one side nostril, breathe in, and then do the other side. So patency is good. There's no lesions, nothing, no drainage. And then for the ears, we're going to be looking for drainage, elasticity, and they're elastic. So I'm going to look inside the ear, and he doesn't have any drainage or lesions. He doesn't have piercings. And then if we would use an otoscope, and we would look inside the ear, and you should see the tympanic membrane. It should be silver and conducent. Yes, sorry, I couldn't think of the word. Lips are pink. We're moving on to the mouth. They're not cracked, no lesions. And then in the mouth, I'm gonna look, and when I'm looking to make sure his teeth are intact. He doesn't have any dentures. Go with your tongue out, please. So his tonsils, I do a 2+, and his uvula is midline. His tongue is rough with rugae, and then lift your tongue up. And on the bottom side, you can see it's glistening, it's pink, and you can see the veins. Okay. All right, and then we're going to go ahead and move on to the chest. So with the chest, we would normally do this without a shirt, but since we're doing this assessment, we're not doing it without a shirt. We would check skin turgor, and we'd check our hair, and his is elastic and good. And then we would look and make sure the breathing is equal and bilateral. And then with the listening, we'll listen to 10 sides anterior, and then 10 sides posterior, and then 2 on the side when I'm listening. And what I'm listening for is to make sure there's no adventitious breath sounds, anything abnormal, that all his breath sounds are equal bilateral, and that inspiratory is greater than expiratory. And I'll start on the back. And so on the back here, turn. So I'll have him say 99 here in a second, and with that we're checking for fermentus and vibration. So go ahead.
99.
Okay.
99.
All right, and then so I'm going to go ahead and listen. And like I said, I'm listening to 10 on the back here. Okay, and if you'll just take deep breaths for me. Okay, and then I'm going to do the sides. Hopefully you can see that. All right, turn to the front, and then I'm going to do the front breath out. Okay, so he had no abnormal breath sound. And when I checked the carotid earlier, when I was listening with my stethoscope, I should have had him hold his breath, so I'll redo that. So when I tell you to hold your breath, just hold your breath for me. Okay, hold your breath. Okay. And then hold your breath. Okay. Alright. Alright, so then we're moving on to the heart, and I'm gonna listen. What I'm listening for is to make sure that we hear S1, S2, making sure there's no murmurs, and just making sure the rate is regular. Alright, so we got your aortic, pulmonic, got your Erb's point, and you have your tricuspid, and then you have your mitral. Okay, so I didn't hear any murmurs, any extra sounds, and so then I'm going to listen to the apical, and I'm going to listen for a full minute. All right, and I've got 76 on rate. All right, and then, so what we'll do when I'm assessing also, I want to look and make sure that I'm not seeing any visible pulsations, because that would be abnormal. And then I'm going to feel, and I want you to tell me if anything's tender, okay? Does any of that hurt?
Nope,
Okay.
no tenderness.
And I'm gonna do it on your back here. Okay, any tenderness?
Nope.
Okay. All right, so then we're gonna move on to the abdomen. So if you can take your shoes off and just kind of lay. On the abdomen, we do the same thing. Make sure on the skin there's no lesions, no scarring, there's nothing there, and nothing is present. His umbilicus is midline, so that's good. So when we assess the abdomen, we always look first, and then we listen, and then we palpate, because palpation before listening could mess up the accuracy of listening. So we've already assessed. I've told you there's no lesions. The color of the abdomen, it is uniform with the rest of the body. The hair is dispersed evenly, and the umbilicus is midline. So now that we've assessed, I'm going to listen. So when I listen, I start in the right lower quad first, then go to the right upper, then left upper, and then left lower. You always listen for a full minute for the bowel sounds. If you can't hear any bowel sounds in a minute, then you have somebody else assess it. And then 5 to 30 is normal. Less than 5, they're hypoactive, and then greater than 30, they're hyperactive. So I'm gonna listen. Okay, so his bowel sounds are within the normal range. I did not listen a full minute in each quadrant, but they were. So now I'm gonna palpate any tenderness?
Nope.
Alright. Okay, and with this, in the right upper quad, you have your liver and your gallbladder. In your right lower quad, you have your appendix. In your left upper, you have your stomach, spleen, and pancreas. And then in the left lower, you have most of the small intestines. So now I'm going to look at the lower, his legs, the peripheral vascular system here. We're checking hair, we're checking color, checking to see if there's any swelling. He has no swelling, his hair is evenly dispersed, his coloring is good. Can you bend your knees for me? Okay, and bend this one and put them back down. So he has full range of motion in his lower limbs. The checking the cap refill on the toes, so they're less than 3 seconds. And then I'm going to check his pulses. So he has the posterior tibial here. These are sometimes hard to find, but you want to make sure that they're equal bilaterally, and they are, and I would say these are a 2+. And then I'm going to check his dorsalis pedis, and these are hard to find sometimes too, but if you press real light, you can usually find them. And these are a 2+ equal bilateral as well. And I think that is the full assessment. If you'll sit up, I forgot to, no I didn't, okay. All right, and then do you have any questions?
Nope.
Okay. All right, and that completes the assessment for today.